everybody. Again, we had an unspeakable tragedy here in Fall River last night. Our thoughts and prayers are with the families of the victims. I'm prepared to tell you this morning that 9 people lost their lives in this building last night. We have one in critical condition, but we had over 30 transported. We had at least a dozen people rescued over ladders. The police department, fire department, and EMS were able to enact dozens of rescues to save multiple lives in this case. So I applaud the efforts of them, but my heart goes out to the families of those who were injured, and especially the 9 who lost their lives. I'm prepared to answer questions if I can, and then we'll move on from there.
You just kind of choked up there.
Yep.
Once again, just tell us about the emotion coming here, seeing what you saw, and now this aftermath.
Yeah, I mean, this isn't what we're designed to do here, right? We're here to save lives, and any time that any life is lost, a single life is lost, is a tragedy in our minds. It's a failure of our job. But we know that there are forces beyond our control, and that things like this unfortunately happen. It still makes it difficult to talk about and to think about and to fathom, really, for anybody.
Where does the investigation stand of trying to determine how this fire started?
We're still very early on that. I wish I could share anything more than that, but the investigation is ongoing.
Can you talk a little bit about the extent of the damage, as we can see over here in the front? I mean, there's about 100 units in here. You said about 70 residents. How far does the damage go throughout this building?
The damage is maintained. The fire damage is maintained to one wing in the building, but the smoke damage is throughout.
Can you speak to how many workers were there versus how many people living in the building at the time?
I'm not prepared to speak to that. I honestly don't know at this point. That's more information that we'll be able to have as the investigation goes on.
Looking at the building, it doesn't look too damaged. Would you say the smoke really was the main thing that really affected the people inside?
Yeah, I think it is. We always try to learn lessons from any scene that we're at, and I think what we need to preach is that smoke is the most dangerous part of any fire. Really, right? It's the most damaging part of any fire, and smoke kills more people than fire does every day in America. So I think that the lesson that can be learned here is that listen to your smoke detectors and react, because smoke is a very deadly force.
Were the smoke detectors working at the time? We hear stuff in the background.
They're still going on right now, but I can't speak to whether they were working at the time of the fire.
And those victims, did they pass away during the fire or when they were transported in the hospital?
I would say there are multiple. So there were some that perished in the building, and some perished after being transported.
Are there still some in the building at this time?
No, the building is clear right now. We're preparing to turn the scene over to the building owner.
What were the ages of the...
I don't have that information right now.
Does this building have sprinklers?
It does.
And did those go off?
I can't speak to that right now.
Were there codes concerns in this building?
There always are. Listen, anytime there's a fire in any facility, there are code concerns. So that's a standard part of any investigation.
As for the building, total, are people going to be able to live in there?
We're not there yet.
And right now, where are the people, the others that survived this? Where are they right now?
So the city opened up a shelter that we use for mostly like inclement weather shelters. So they're at a shelter in the city that they opened up for the victims, and we'll be working with them throughout the day to make sure that they have a place to stay.
Do you know if the Red Cross is also helping at this point?
The Red Cross has been notified. Yep.
We know there was a reunification happening. Have families been told about their loved ones who did pass?
We're still in the process of notifying the families, so that's an active process, and we still encourage people to go to St. Anne's Hospital, to the chapel, enter through the emergency room if they need any information about their loved ones.
I do want to say something about the shelter we opened. I was down there this morning. Everybody had breakfast. Everybody was very complimentary. The city services, we literally bust them down there at like 12 or 1 at night last night. One of the issues we're facing this morning is getting the people their medicine, because when they were evacuated, they have nothing. We have people at our stores right now buying underwear, t-shirts. There's a place there for them to shower. So we're going to do our best to support them all day, and we'll see how this works out. We don't know what the long-term plans are, but we'll work, obviously, with the police and the fire. And I do have to say something about the fire last night. Spectacular work trying to save lives and get this place under control, and the police making sure they maintained control because it's a very chaotic scene, and these guys did a spectacular job in the face of a very bad tragedy.
Mayor Coogan, talk about your feelings. I can see you're
It's horrible. I mean, this is the kind of thing you don't want. Middle of July, Sunday night, and the city explodes around a tragedy like this. It's not good for anybody, but with the right people in place, you're able to maintain a level of control and a level of safety for all the residents. As you can see, this didn't spread anywhere. They kept it in that wing as best they could. It was more the smoke, as the chief pointed out, and these guys up and down the street did a great job last night.
And there are people who want to know, obviously how this started. The investigation is ongoing.
I'll
but
go with his comments on that. We're not ready for that.
For family members who want some accountability, how this possibly happened, what do you say to them?
Yeah, so I would say that the investigators that are here are top notch, and that will work its way through the investigation.
Can you describe what those firefighters walked into? I know you had pointed out earlier this morning that it was the main entrance was really the engulfed part, but what did they see as they got through that building?
I think I can't speak to what they saw inside the building. When they pulled up, though, obviously our first priority is life safety. So when you pull up to a building, the first thing you see is the fire, but then you see the multiple people that are asking to be helped and begging to be helped out the windows. So that's where it complicates the scene and makes everything more difficult. So that is something that none of us want to ever pull up to. So, and unfortunately, like I said, that happened here last night, and we just pour our prayers out to the families of those who were hurt and killed.
And how are those 5 firefighters that were injured doing?
They're going to be all right. They were mostly minor injuries. Most of them, actually, I think they've all been released.
Can you talk about the manpower that came out here? You mentioned earlier that every single firefighter that was working in the city
Yep.
last night came out. Can you just talk about the manpower that it took to put this out?
Yeah, and it wasn't just the fire department. I want to make sure that that's clear. We had 35 firefighters immediately on scene, but I was here, and every police officer in the city was here too, and everybody was rescuing people. EMS was in the triage area, and they were actively rescuing and saving lives. So we have a very strong and powerful public safety presence here in the city of Fall River, and it worked the way it was supposed to last night to save lives.
Of course, this being an assisted living facility, some residents with mobility issues and all, does that impact the life-saving procedures?
Yeah, absolutely. Absolutely.
Clarification, was it 9:30 or 9:50 when you guys first?
Those numbers are jumping in my head. I believe it was just shortly after 9:30.
Shortly after 9:30.
That the boxing came in. Yeah, it was an automatic alarm that came to us.
Of those 30 people you mentioned that were transported to the hospital, what are the range of their conditions? Are most expected to be okay?
Yeah, so there's one in critical condition right now. I don't know the condition of all the others, and it's going to be upwards of 30 that were transported. At the very beginning, there were people that were self-transporting. The hospital's right across the street. So we'll have a better idea once we can sink our teeth into this morning, exactly how many people self-transported, how many were transported, and what their conditions are.
What hospitals are they at? Some here.
People were transported to St. Anne's, St. Luke's in New Bedford, Charlton in Fall River, and I believe from there some were transported to Rhode Island Hospital.
Has anyone had to be transported out of the hospital? What wing and, with all the medical beds that are being used up, has there been any other movements inside the hospital right now?
I don't have that information for you, but the EMS was very particular about spreading the victims and where they were transported, not to overwhelm any particular hospital.
And for the crews who showed up last night, what do you hope that, they take from this and that, maybe going forward everyone learns?
I'm sorry for...
For the first responders, what do you hope everyone learns from dealing with a situation like this?
I really can't speak to that right now. I mean, it's too raw right now. I think after we leave here, my next step is to go to the stations and to make sure that we're checking in with those firefighters to make sure they have the support they need. Everyone thinks firefighters are heroes and they're just designed to be able to deal with anything. but that's not the case. And the mental health aspect of this for not just the firefighters, the police officers, the EMTs, and the families that were here. That's a message that I'm a strong advocate for mental health support. And I would say that for anybody that was at this scene last night, not just firefighters, police officers, EMS, to seek the help that you need to deal with the tragic situation like this. Nobody's programmed to deal with this. Thank you, guys.
Mayor, what kind of impact do you think this has on the city?
I think these are the kind of things that a city is judged by. How do they deal with a problem like this? This was dropped in our lap last night at 9:30 on a Sunday night, and the city was able to mobilize extremely quickly to prevent further deaths, get people into shelter, get people medical care. It was working like a trip hammer over here, and I'm very proud of everyone.
Thank you, everybody.
Thank you.
Next updates will probably come from press release. If there's anything significant and we need to hold a press conference, we'll be sure to let everybody know where and when.
Thank you very much.